20 years ago today, frantic evacuations were still underway after Hurricane Katrina did this to New Orleans, just devastation. That experience, though, led a Nashville healthcare company to dramatically rethink how they prepare for emergencies. Our Chris Davis shows us why.
That's the morning after the shooting in Las Vegas.
Snapshots from America's darkest days.
2017 Hurricane Harvey
line the walls at HCA's Emergency Operations Center. It's in this facility, and usually at this table,
I operated in a lot of these environments without this,
where the healthcare giant tries to make sure their hospitals have the resources they need to help others.
The capabilities we have developed over time has absolutely saved lives, no question.
But this space all came to be after it was one of their hospitals that needed saving.
Of course, the hurricane hit, and then we immediately thought we had dodged a bullet.
20 years ago this week, Hurricane Katrina made landfall, and Tulane Medical Center was largely spared. Then the levees broke.
It went from let's hunker down and just kind of manage through it to we have to get everybody out.
But the roads were impassable, local cell phones weren't working, and the water was rising.
Literally, we started running through the Rolodex of helicopters.
Back in Nashville, using a network of ham radios and landlines, Ed Jones and his team were able to relay which patient was being flown where.
And either we would fly them directly out from a helicopter to a location if it wasn't too far, or we would take them to the Louis Armstrong Airport.
Over 3 agonizing days, they evacuated more than 100 patients and 1,100 employees. And with some time to spare, their helicopters even evacuated several patients from a competing hospital.
You didn't see whether it's an HCA patient or a charity patient, you saw a patient. And we're in the business of healthcare.
We set up phone lines so that people could call in.
Attention then focused to displaced HCA employees. HCA was already in the process of setting up an employee assistance program, but Katrina accelerated the timeline.
We were able to work with the IRS to get that approved in 2 weeks.
It was some of the lessons learned from that Katrina evacuation that led to the creation of this space, so they would be ready for the next emergency.
And we learned a lot from Katrina.
Using this command center, the team at HCA knows they'll be able to make better decisions using way more than just a snapshot of information.
The team around this table thinks about what's next, what happens if.
Chris Davis, News Channel 5.
That HCA Employee Assistance Fund, HCA Healthcare Hope Fund, has gone on to give out more than $100 million in grants to employees and their families in the wake of various tragedies.